Ladies and gentlemen, this is more terrible news for the opioid crowd. This came out on Reuters, July 25th, 2018. Opioids tied to bad sex life and lack of desire. Just when you thought it couldn't get worse for opioid addicts, they're out here having bad sex lives, y'all. Chronic pain patients who take opioids may be less satisfied with their sex life and more likely to experience a lack of desire than people who don't rely on these prescription narcotics, a Danish study suggests. I don't know, y'all. Maybe they should do what Jeff Sessions say, pop a few aspirins and go somewhere and stop whining. Researchers examined data from questionnaires completed by 11,517 randomly chosen adults in Denmark in 2013. Slightly more than half of the women and slightly less than half of the men said they suffered from chronic pain that wasn't caused by cancer. Compared to people who didn't have chronic pain, individuals who did experience pain but didn't use opioids were 38% more likely to be unhappy with their sex life and 46% more likely to report a lack of desire, the report found. You think this may be tied to low birth rate, y'all? So many of them out here are on opioids, I wouldn't be surprised. Long-term opioid users were 69% more likely than pain-free individuals to report dissatisfaction with their sex life, and more than twice as likely to experience low or no desire. Short-term opioid use, meanwhile, tied to 82% higher odds of low desire and 35% greater odds of sexual dissatisfaction. Pain suffering from chronic non-cancer pain should be aware that it can have a negative impact on their sexual desire and satisfaction with sex life, and that using opioid, especially long-term, can add an additional negative impact on their sex life. Well, sounds like part of the drug side effect. Other treatments like rehabilitation and behavior therapy may work as well, if not better, for many types of chronic pain without having these sexual side effects. Unlike just popping a pill, these more active treatments may help patients develop strategies for coping with chronic pain. Amid worsening epidemic of opioid addiction, doctors often try to prescribe alternative painkillers or other therapies for patients with chronic pain unrelated to cancer. For a cancer patient, particularly at the end of life, opioids provide relief from severe pain, and there's less concern about long-term risk of addiction. While opioids have long been linked to sexual problems, the current study offers fresh evidence that the duration of opioid use might influence the magnitude of difficulties with sexual desire and satisfaction. The study team writes in Pain Medicine. In the study, pain patients who used opioids long-term were 81% more likely to report a lack of sexual desire than individuals who didn't take opioids for pain. So what this pretty much sums up and says is when they're on the opioid for a long-term period of time, it impacts their sex life. So they're having far less or no sex at all. Or when they have sex, it's bad sex, y'all. Bad sex. Compared to 62% of patients with short-term opioid use, 68% of patients not taking opioids, and 77% of pain-free people in the study. Researchers define short-term opioid use as having at least one prescription dispense in the previous year. So long-term are the people that had been prescribed opioids at least 6 times in the previous year. So they consider that long-term. Overall, 19% of the men and 14% of the women without chronic pain still reported dissatisfaction with their sex life. And 7% of the men and 19% of the women without pain indicated a lack of sexual desire. The result add to evidence that the chronic pain and opioid treatment can damage sexual health, said Ann Murphy, a researcher at the University of Georgia in Atlanta. Chronic pain hijacks sensory nerve fibers, thereby making it harder and impossible for pleasurable stimuli. Okay. On top of that, opiates suppress the activation of sensory nerve fibers, which would be an obvious impact on sexual pleasure. When people do take opioids, they should work with their doctors to make the medication dose as low as possible to reduce pain, sensation, but allow them to experience pleasure, sensory stimulation during sex, Murphy advised. So these folks are suffering all the way around. They have an opioid addiction. They have a bad sex life. They have no desire. I don't know. Again, do you think this is tied to the low birth rate, the lack of desire? Because there's a lot of junkies out here. I mean, let's face it. You can't turn the corner now and run into these junkies. They're everywhere. And they're definitely more interested in getting high than a sex life. But it just sounds to me like it's a side effect to taking the drug on a long-term basis. But please tell me what you think, ladies and gentlemen. Please leave your comment and subscribe. Don't forget to hit on the notification bell, and I'll see you on the next video. Peace, family.